Tetralogy of Fallot is one of those diseases we've actually recognized for a very long period of time. From a historical standpoint, it was first recognized by a series of children which were blue. Interestingly, many of these children got better when they squatted down or got into particular positions.
Because they have to drive more blood to the lungs, and that's what happens when you squat down.
The first successful operation was done in the mid-1940s at Johns Hopkins, which was a shunt.
The so-called Blalock-Taussig shunt, which was one of the first operations devised for children with cyanotic congenital heart disease, that is, patients who are blue.
It was a tube to carry blood flow from the aorta to the lungs, and all of a sudden these blue babies would become pink. This did not correct Tetralogy of Fallot. It was a palliative operation.
But it made a huge difference. Children who were dying of blueness or cyanosis actually were able to survive and get into adulthood. And so it was a major advance. Then in about the early 1950s, the heart and lung machine was developed. And when that came along, it was possible to actually fix this heart defect.
Robert comes back once a year for follow-up now. We usually have our annual echocardiograms, and he's on no medication, and he has no restrictions, and he's just an active little boy.
Now, as with other complex heart lesions, we've moved towards early complete repair.
Such that the vast majority of kids with Tetralogy of Fallot at the Children's Hospital of Philadelphia get a full, or what we call a complete repair, upon diagnosis.
We are quite fortunate to have some patients who are now in their 30s and 40s, even to the extent that it's not uncommon for us to have a mother who's had repair of Tetralogy of Fallot performed maybe in the 60s and 70s, who now come to the fetal heart program carrying a fetus for evaluation.